Hi, I'm Elizabeth Suvedi. I work for Corewell Health. It's the largest health system in Michigan, and I oversee their culinary medicine program. So we work with underserved populations, we work with medical residents, we also have shared medical visits where we work with patients, all trying to help them prevent and reverse disease. And I am a chef instructor as well. Culinary medicine is helping people learn the art and the science of cooking with food and how that food can then in turn help people prevent and reverse disease. And also as a chef, it's got to be delicious and taste wonderful, and really then helping people hopefully feel empowered in their own home to start cooking and eating that way. I think it's really important to have the certification because it really lays the foundation for people to make sure they have that breadth of knowledge in culinary medicine and food as medicine. I think each person can take it deeper in different areas where they would like, but I think it helps to give people that general knowledge they need in various areas, whether it's learning about whole grains, fruits and vegetables and the power of those, how to cook with them, some of the challenges people can be faced in food as medicine, and really bringing that community together. So I know when I was in my cohort, it was great to come together each month as a group as we were presenting on various topics, learning from others and what they're doing. I work in a health system setting, but a lot of people in my field were in other areas within the culinary industry within the United States. I think like anything, it's like building it into your life. So for me, I have a very busy schedule. I'm kind of always on the go. I'm a working mom with teenage boys. So I had to purposely put it into my calendar. So every 2 weeks, I would set aside an hour of time to make sure that I was dedicating to that work. I was also going through the program with a colleague, and so her and I would spend that time together. So we would watch, if there were videos to watch, we would watch them together. We would pause it. It allowed us to have conversation and dialogue. And then also when it came to the projects, we would work together to help support each other, to work on those collaboratively. And also just, I think you learn better when you're with other people. I would encourage them to do so. I think it's worth the investment of someone's time. I think it's very important. We've had a few people go through the program since I've gone through it at our organization, and all of them that have finished it have really found it to be valuable. I know it's difficult. I know it definitely is time consuming, but I think it's worth carving out that time to work through it. And like anything, I think it's just like you work a little bit at a time on it so that it doesn't feel like it's so overwhelming at any point in time. I know when you finish, there's definitely a sense of relief, that that's done. But I also think the people that are going through it, they are chef professionals themselves, and so really value being able to get that additional education that they know is going to help them in their current career and possibly and hopefully in the future as well. Yeah, I think it's really the responsibility and the right thing to do as a chef to not only provide that the deliciously tasting food. I know as chefs, they're first thinking, are people going to enjoy the food? But I know you can have delicious food that is also good for people. And I think that people will recognize that in the food that they're eating, and there's even more chance then that they will return back to your organization to eat again, knowing that they left satisfied from a taste perspective, but also they didn't have that guilt sense perhaps, knowing that like, oh, that was unhealthy food that I was eating. Yes, it was delicious. I think they're more apt going to seek your organization out to eat at that establishment. So I really think that doing both is just going to make them that much stronger as their brand as a chef, their brand as an organization, being able to cater to both of those. And then the other piece also is always being cost conscious. As we know, prices are rising. And so I think really having that other element as well, which we try to teach to quite a bit in our culinary medicine classes, is around you've got to have delicious food, healthy food, but also being conscious of the ingredients you're using and the cost that goes into that. And we know you can check all 3 boxes. Ooh, recipe or ingredient. I am a big fan of smoked paprika. I think I do a lot of plant-based cooking, and I think that smoked paprika is a great ingredient where it gives you a little bit of pop of color depending on what you're putting it on. It gives that umami type taste I think a lot of people are craving, and sometimes if you don't have meat, people might feel like, oh, there's not that umami, that rich flavor. But I think using smoked paprika can really add some nice flavor into any dish that you're preparing and cooking.